For the muscles of the hand, we can divide into three main parts, which are: the first one is tena eminence, the second one is the middle of the hand, and the last one is hypotena eminence. And for the tena eminence, we have three muscles that involve in this part. The first is opponent's pollicis. Next is flexor pollicis brevis. And the last one is abductor pollicis brevis. For opponent's pollicis brevis muscle, the name itself stated that it opposes the thumb, which the movement of this muscle is the opposition of the thumb. The origin of this muscle is at flexor retinaculum, tubercle of scaphoid, and trapezium. Meanwhile, the insertion of this muscle is the lateral side of shaft of first metacarpal bone.
For the next tena muscles, we have the flexor pollicis brevis. It has two origins. First, the superficial head, which attach at flexor retinaculum and trapezium, while the deep head attach at trapezoid and capitate bones. The insertion of this muscle is at the base of proximal phalanx of the thumb. The actions are opposition and flexion of the thumb.
And the last muscle in tena eminence is abductor pollicis brevis muscle. The name also stated that the function of this muscle is help in the movement of thumb, specifically the abduction of the thumb. The origin of this muscle is at flexor retinaculum, tubercle of scaphoid, and trapezium. Same with the opponent's pollicis brevis muscle. And the insertion of the abductor pollicis brevis muscle is the lateral base of proximal phalanx of thumb.
Next, move to the middle of the hand, which is adductor pollicis. Adductor pollicis has two heads of origin. The first one is from oblique head, that actually a base of second and third metacarpal bones and capitate. The second one is transverse heads, which is originates from anterior surface of shaft of third metacarpal bone. The insertion of adductor pollicis is at the medial side of base of proximal phalanx thumb. For the action of this muscle causes the adduction of the thumb towards lateral border of the palm.
Next, the lumbrical muscles of the hand. Lumbrical muscles are four short intrinsic muscles of the hand located between the metacarpal bones deep to the palmar fascia. There are four lumbrical muscles, and each of them originates from tendons of the flexor digitorum profundus and inserts onto the extensor expansion of medial forefingers. The first lumbrical arises from the radial side and palmar surface of the tendon of the index finger. The second lumbrical arises from the radial side and palmar surface of the tendon of the middle finger. The third lumbrical arises from the ulnar side of the middle finger tendon and the radial side of ring finger tendon. The fourth lumbrical arises from the ulnar side of the ring finger tendon and the radial side of the little finger tendon. The lumbrical acts to produce both flexion of metacarpal phalangeal joints and extension of the interphalangeal joints.
There are three palmar interossei muscles. The attachment, each interossei originated from a medial or lateral surface of a metacarpal and attached into the extensor hood and proximal phalanx of the same finger. The action is to do adduction of the digits and also to assist in flexion at the metacarpophalangeal joint and extension at the interphalangeal joint.
Located between the metacarpals, the dorsal interosseous muscle are a pair of intrinsic hand muscles. The four dorsal muscles that make up this group abduct the fingers. Additionally, the dorsal interosseous aid in the extension of the interphalangeal joints and flexion of the metacarpophalangeal joints.
Abductor digiti minimi is the one in the blue color. The origin is at the proximal row of the carpal bones on the middle side that called pisiform. It inserted into the base of proximal phalanx of little finger. The action that involved is abduction of the fifth finger, which is little finger.
For flexor digiti minimi, the proximal attachments lies on hood of hamate and flexor retinaculum, while distal attachment lies on medial side of base of proximal phalanx or fifth digit. The action for flexor digiti minimi is it can flex the proximal phalanx of fifth digit.
The third hypothenar muscle is opponens digiti minimi. The proximal attachment of this opponent digiti minimi muscle is at the hook of hamate and flexor reticulum, while for the distal attachment is at the medial border of fifth metacarpal. For the main action, the opponent digiti minimi draws the fifth metacarpal anteriorly and rotates it laterally, therefore causing deepening in hollow of the palm and also bring the fifth finger into opposition with the thumb. The opponent's digiti minimi acts exclusively at the carpo-metacarpal joint.
Palmaris brevis is originated from the palmar aponeurosis and inserted into the skin and fascia of the medial palm. Palmaris brevis is innervated by the superficial branch of the ulnar nerve. The action of the palmaris brevis is to improve the palmar grip action by pulling on the skin over the hypothenar muscle, which deepens the hollow of the palm.